Good afternoon, everyone. Today, as usual, I am going to give an update on the epidemiology and the trends that we're seeing in the pandemic here in Washington State. And I'm also going to present some data from our disease modeling group. We're releasing their most recent report today, and that will be available online. There will also be a press release coming out today, and I'll show you some of that data. So first of all, I just wanted to start by just by showing how the U.S. COVID-19 rates have compared to other countries. And I think, as most of you guys know, the rates here in the United States have been higher than most other countries around the world. This next slide shows a little bit about how compares how the COVID-19 rates here in Washington State have compared to other states. Now, I know this slide is really busy, but one thing I wanted to point out is that if you look over to Washington, our line looks really, our rates of COVID-19 here in Washington have been, fairly low compared to all the other states. And if you look around to all the other states, almost every state has experienced a fairly large spike in cases. And we fortunately have been able to avoid that here. There have been a few other states, Vermont, New Hampshire, and Maine, whose data, looks really nice and flat, but you can see these big peaks in a number of the other states. And I wanted to point this out because I just wanted to really make sure that people understand that the changes that they've made in their lives and some of the sacrifices people have made in their lives are paying off. We are seeing less activity than other states, and we know that all the changes that people have made in their life have prevented disease and have saved lives. So just want to thank everybody in Washington for pitching in and doing their part, and just encourage everybody to stay at it, so we can continue to keep this disease at bay. So moving on, I just wanted to point out that our testing continues to increase. This is the number of tests that we perform here in Washington per day. As you can see, we recovered from the dip in the number of tests performed that we experienced around the Labor Day weekend and the smoke event. And it looks like our data from last week, which is still preliminary, is going to show that we have we may be reaching the highest testing volumes that we have ever had, which I think is really great news for us. At the same time, this graph shows that our confirmed cases are increasing here in Washington. This is our epidemiologic curve of just people who have tested positive. And in some subsequent slides, I'm going to try to break this down a little bit more for you. If you look at the proportion of positive tests over the past several weeks, you can see that there has been a slight increase. But hard to really tell. Looks like maybe we're potentially flattening out. Need probably a few more weeks of data to understand what's happening there. The top graph shows that our COVID-19 hospitalizations may be slowly increasing. If you look at the section of the graph in yellow over here to the right, it does look like there's a slight increase in hospitalizations. The data that are gray, as a reminder, are still preliminary. And COVID-19 deaths have been sort of bouncing around a little bit, but appear to be fairly stable. So this slide comes from the modeling report that will be released today, and it breaks down our COVID cases into cases that are occurring in Eastern Washington versus Western Washington, and also looks at hospitalizations and deaths. So if you start out on Eastern Washington, you can see that their total positive tests, which is also the number of people testing positive each day, have been really fairly kind of flat, but have bounced around a little bit. Again, the hospital admissions have kind of gone up and down. It's a little bit hard to tell. I'd say the data is a little bit unstable at this time, and a little bit unclear as to which direction things are going in Eastern Washington. But if you look over at the graphs in turquoise, you can see that the number of cases in Western Washington is clearly increasing, as shown by the graph, the red circle. And if you look at the hospitalizations, it does look like hospitalizations may be slowly increasing as well. So when we look at overall as a state, it does appear that case counts are increasing, and most of this increase is coming from Western Washington. I didn't include any county-specific data, but I can tell you that we are seeing upticks in a really broad geographical area. And in fact, most of the counties in the greater Puget Sound area are seeing increasing cases. So every week, our modeling team estimates what the reproductive number is, and you can see that the reproductive number in both Western and Eastern Washington is around 1. It appears to be a little bit higher in Western Washington, a little bit lower in Eastern Washington. And then this graph from our modeling report shows the cases by age group. And so if we look first at the top graph, which shows the positive COVID tests in Eastern Washington, you can see that this big blue line here represents the WSU outbreak. Those are individuals 18 to 24 years old. And then we see a second kind of peak in the 18 to 24-year-old age group. And other age groups appear to be kind of fairly flat, which is consistent with the data we're seeing in Eastern Washington. If you look at the data from Western Washington, one thing you'll notice over on the right-hand side of the graph is that we're seeing increasing cases in all age groups together. And that suggests that transmission is really happening throughout the community in many different settings and in many different age groups, which, to me means it's a little bit more, it's more difficult to control because it's harder to just target interventions at one or two places. And then I just wanted to close out with a slide that that shows our health disparities. This graph shows rates of COVID cases by race and ethnicity by 2-week time periods going through about the end of September. And you can see that we are still continuing to see the highest rate of cases among persons who are Native Hawaiian or other Pacific Islander or Hispanic. We're also seeing that the rate of cases in persons who are Black is higher than persons who are white. So the lowest lines represent people who are white, Asian, or multiracial. So unfortunately, our health disparities continue to persist. So in conclusion, I think overall Washington State has controlled COVID-19 activity better than a number of other states, but it doesn't mean that our job is done. We still have a lot more work to do. Currently, it appears that COVID-19 activity appears to be increasing in Western Washington and possibly plateauing in Eastern Washington. The numbers are a little bit less stable in Eastern Washington at this time. As I showed, cases are increasing in all age groups in Western Washington and over a broad geographic area. Unfortunately, health disparities do continue to persist, and the good news is that testing is increasing across the state.